So the COMFORT studies were pivotal studies. There was COMFORT 1 in the US and COMFORT 2 in 9 countries in Europe. These were randomized phase 3 studies that were comparing Ruxolitinib, a JAK1/2 inhibitor, to placebo in the US and best available therapy in Europe. And what these studies, both studies showed was that Ruxolitinib was superior in reducing splenomegaly and improving symptoms, mostly by down-modulating inflammatory cytokine signaling. The deficits of this drug have been myelosuppression, so the dose-limiting toxicity of Ruxolitinib is thrombocytopenia, and a certain proportion of patients will incur anemia. If you have a patient with advanced myelofibrosis that has thrombocytopenia less than 50,000 platelets and or significant transfusion-dependent anemia, Ruxolitinib is not necessarily the most desirable drug to use, which sort of opened the way or opened the door for second-generation TKIs against JAK2, namely pacritinib and momelotinib. Pacritinib is a JAK2 FLT3 inhibitor that is targeting a niche that is unmet, which is low platelets, so less than 50,000. And the phase 1/2 data that's been presented thus far, as well as the first PERSIST-1 randomized phase 3 study, was very encouraging that in the low platelet population in particular, these patients really garnered benefit from the drug, and there was not a significant amount of myelosuppression attributed to the drug. In fact, 25% of patients treated on that arm in the PERSIST-1 had achieved transfusion independence, which is very different than what is seen with Ruxolitinib.